Hello, everyone. My name is Kimme Huntington, and I'm a health educator for Campus Health and Wellbeing. A little about me. I completed my undergraduate education from Cal Poly with a bachelor's degree in nutrition science. Earlier this year, I've completed my master's degree in public health from San Diego State University. Currently, I enjoy working with Cal Poly's peer wellness programs at the health center. I work with student volunteers or peer health educators to help provide health education and promotion material to the campus. I also help manage a lot of the budgets for our programs, and today I'll be reviewing Christine Nelson's presentation on program budgeting and implementation, highlighting how this material translates to an on-campus program like the Cal Poly Food Pantry. I'd like to pause and reflect on why budgeting is important for public health work. Please take a moment and ask yourself, why is budgeting important? One argument is that public health requires resources, time, money, people, just to name a few. These resources are often supported with public funds or taxpayer money. Taxes and competition of resources are political issues that we should be comfortable talking about as public health professionals. Budgeting for our programs is essential to our argument for the allocation of these resources for the health priorities that evidence-based research supports. So, if we're interested in advocating for essential health programs, we need to know how to budget and what we should include in one. Hence, we need to define what a resource is for our program. Johnson and Brecken define resources as human, physical, and technical assets available to plan, implement, and evaluate a program. Resources are mainly where you receive revenue or financial support. In terms of expenditures, what you will need to buy or secure for the program. Your professor has listed a few expenditures that would be expected on a budgeting form. Personnel, someone internal or external. Supplies for all implementation and evaluation of the program. Equipment for all implementation and evaluation, and indirect costs. Every potential cost or need should be accounted for and assigned a financial number for your budget. Some common definitions that help describe budget line items are listed here. An in-kind good or service is donated as opposed to costing you cash for one on your budgeted line items. These should be calculated in your budgets and the donor should be identified. The good or service should be projected by its wholesale cost. It is also important to identify fixed or variable costs for your budgets. A fixed cost shouldn't vary and should be expected. Rent is due at the first of the month and is a set price upon a lease agreement. However, a variable cost can depend on the outcome of the program. For example, if you're planning a marketing program and pass out flyers, the cost of paper can vary. All right, let's take our definitions from what we've learned and apply that to our case study, the Cal Poly Food Pantry. Student hunger is a growing concern at all colleges around the country. At Cal Poly, together with the help from several generous donors and the local San Luis Obispo community, we're working to resolve this observed need. The idea of a food pantry was created out of need identified by faculty and staff who were seeing an increased number of students going hungry and without the means to purchase basic food and supplies. The food pantry is a part of the Cal Poly Basic Needs program, which ensures that all students have access to nutritious meals every day in order to stay focused on their success at Cal Poly. It's a short-term service that is available weekly to assist students who are experiencing food insecurity due to financial struggles. Students can choose from a wide variety of packaged and canned foods, frozen meals, and personal hygiene products. Students may depend on the service to meet their basic needs. Therefore, it's important to the vitality of the program that we manage and budget properly to ensure the longevity of the program. So way back in 2014, the pantry started with minimal resources and supplies. Food was donated by staff and faculty and was kept in a supply closet of Health Education. Through the diligent work of Cal Poly staff, the program was quickly supported by the Cal Poly Foundational Board. By 2015, a larger area was secured within Health Education, a fridge was donated in kind, and food was now being purchased with donor funds. As knowledge about this service grew, so did demand. Resources and expenditures were far outreaching expected budgeted numbers. Additionally, national attention for student hunger provided an opportunity for grant funding, leading to increased time spent by the Health Education staff. By 2016, we saw a 63% increase in the utilization from the past year. More Cal Poly students were using this service. Many of campus entities had donated to the program by then. Cal Poly Eggs and Dairy, as well as student groups like the Real Food Collaborative, were making regular donations to the Cal Poly Food Pantry. Campus Dining was offering their time and utilization of distribution services to help support the program. And at this time, around 2016, we were primarily relying on the solely donations and did not have a commitment of long-term support. Our total expenditures that year, once we were able to buy food, ended up costing $44,390.43. In 2017, we increased our staff and hired Christine Nelson, a health educator, to come on board and support and grow a lot of the food programs on campus. Her partnership with the Slow Food Bank helped us save money on food and purchases and expand our food services to include a monthly distribution site on campus. We received lots of publicity, which helped us fundraise for more resources and also reach more students, leading to another increase in utilization, roughly 25%. We're now spending a little less money, $37,434, because the food bank was subsidizing a lot of the costs of food. We were buying less expensive food items, which greatly helped us lower our expenditures just slightly, while still maintaining growth in utilization. All right, 2018. Our growth in personnel, fundraising, and utilization warranted the need to seek out more resources. We applied for grant funding and rewarded $130,000 to help support other programs that we hoped would help us generate revenue to keep the food pantry open without the support of donor funding. We started a farmer's market on campus that we could charge vendors a fee to sell produce and goods on campus. Additionally, we wanted to create a food hub that would connect students with food vendors or available meals for students that we were still working on today. Our program surely benefited from the timeliness of the CSU Food Insecurity Report. Our data collection of utilization rates and tracking expenses helped generate the need for grant funding and further exploration of this health crisis, which allowed us to expand our services. In 2018, we're kind of leveling out our costs. We're spending some of that grant money, and our total expenditures is roughly close to $39,000. So right now, our current average cost of expenditures is leveling out at around $40,000 per year. It's really important to note that this is one budget line item, right? Buying food, paper, but does not include the in-kind costs of staffing, space, equipment, utility costs by the Health Education Department. We're actually looking to hire someone, another health educator, solely for basic needs, which will not only support the food pantry, but also a lot of the Cal Poly Hunger programs. But yeah, $40,000 is really cheap for a program like this. And we're able to do so with the food bank partnership. From the insights of Food Pantry, our budget didn't limit us, as we were always exploring other avenues of revenue and cost-effective partnerships to save on expenditures. Our budget helped us identify where we could expand and helped us get to that expansion by providing data to gather support and resources. Without budgeting, we wouldn't have seen the expansion or partnerships that were established in the last few years. All the meanwhile, we're working on helping Cal Poly students reach their unlimited possibilities. Thanks for listening. Feel free to send any inquiries to wellbeing@calpoly.edu, the email listed on the slide here. Have a great day.